This is a 77-year-old lady who had a knee replacement 4 years ago, and she started having some noise underneath her kneecap when she'd bend and straighten her knee. She'd have pain when she was getting out of a chair underneath the kneecap with noise, sounding like kind of Rice Krispies. So when she bent her knee, you don't have the audio here, but when she bent it, just underneath her kneecap, you would hear like a noise, and it was some tissue that was grinding underneath the kneecap that had formed after the knee replacement surgery. So it caused her pain. So we ended up with an arthroscopic surgery, and I want to show this case because I just want to highlight how sometimes when people have some problems with their total knee replacement or any kind of knee replacement, they don't necessarily need to have it redone. Sometimes we just have to go in and clean up scar tissue. So this is a arthroscopic surgery of the knee. I sped the video up so that it shortens the video. So this is like 3 times faster. So this is just now starting into the knee. What you're seeing here is the metal implant on the top and the plastic, the polyethylene below on the tibia. And so you can see right there, there's a bunch of scar tissue. This tool is called a resector. It's an arthroscopic tool that removes tissue. So what we see sometimes on these knee replacements after they've been there for a while, sometimes some scar tissue can develop in between the joints, and so this is pretty typical on the inside. I don't think this part was necessarily causing her problem, but we always clean up everything we see. So there's some tissue that kind of can impinge or pinch between the metal and the plastic. This, again, in this case, it wasn't really where the pain was coming from because it was when she was bending her kneecap. And so I'll show you, we'll get to that in a sec here, where you'll see the tissue underneath the kneecap was getting pinched. So this is what we would call the medial gutter, the medial side. Now we're coming into where the kneecap is. So to the top is going to be the patella or the kneecap. And when we do knee replacements, people are always confused how we handle the patella. So the patella is just resurfaced with a 9mm plastic piece. So if a normal patella is like 25 millimeters thick, we're taking off like 9 to 10 and replacing that 9 to 10 with a piece of plastic. Now you're starting to see the plastic on the top, and this is where the scar tissue was underneath the kneecap. Now this tool here is like 5 millimeters. So right up in here above the kneecap, which is in the back here, you'll see I'll start working on that, where all that tissue was being caught. And so there's a condition sometimes people get after knee replacement called patellar clunk. And that's based on an old design from the 70s, and there was a transition in the metal that had a sharp edge, and that sharp edge sometimes would create the tissue to get inflamed and clunk as it went from flexion to extension or extension to flexion. This is where now this needle is coming in to this top of the patella, so I'm making another portal. The portals are what we use to go in with the camera tools, and the portals are like 5 millimeters just to accommodate that camera. So first we localize it with a spinal needle, so that's a long needle. And so I localize it. Now here comes the tool. Now this is the problem area right here. So this is what we cleaned up. So this is a resector. It's got suction on it and like a little vacuum tool, and it has little teeth. So we have to be careful not that we ding up the metal and plastic, but we can remove all that scar tissue above the kneecap, and that's what we're doing right here. So this is above the kneecap in the area we call the pouch, the suprapatellar pouch, the pouch above the patella. So that's kind of after we cleaned it up. And you can see now that's the button of the patella. That's the part that got resurfaced. And you see the mirror image below because that's articulating against the metal. So that was really where the problem is coming from. So we cleaned up all the tissue in and around her patella. And I've done this in the past, and it's very successful for people to have relief of their symptoms. In other cases, we find that there's like wear on the polyethylene or the plastic. And I have another case coming up, and I'll show that. And when we cleaned it up, we found that the material that had been in there for 10 years, it was an older type design, and so that had starting to wear. And so we ended up with, a reason why she was having the pain in that knee. And instead of redoing the whole knee, we just had to change the plastic. And we couldn't really diagnose that without doing the arthroscopy. So sometimes we also use arthroscopy diagnostically. So the summary is that an arthroscopy is a pretty powerful tool to use for either treatment or diagnostic purposes when people have a painful knee or partial knee replacement. Okay, everybody have a good afternoon. Thank you.